1 in every 4 deaths in the United States is due to cancer. I'm guessing that everyone knows is someone who has had cancer, has cancer, or has died from cancer. As a daughter of a survivor, I know a lot about cancer. First, I'm going to talk about the 3 major cancer centers in the United States, where they're located and the research they're doing. Today I'm going to talk about Mayo Clinic, University of Texas MD Anderson Cancer Clinic, and Memorial Sloan Kettering Cancer Center. First, I'm starting out with Mayo. Mayo is ranked number 3 according to the U.S. and World Report. They are located in Rochester, Minnesota, but they also have 2 other locations in Phoenix, Arizona, and Jacksonville, Florida. They are founded by William Worrell in 1863, and they currently have 61,000 employees. According to Mayo, they have millions of patients that come in every year from all 50 states and 150 countries. In the 2014 article, Cancer Immunology and Immunotherapy Program, they are developing tests to figure out what types of cancer cause what and how they figure, like they're trying to figure out how our body detects them and how we respond to them. Another article is called Genetic Varieties Linked to Ovarian Cancer, which is an international study Mayo did with Europe, Australia, and Canada, and they discovered that ovarian cancer is linked to 5 chromosomes. Chromosome 2, 3, 8, 17, and 19. They discovered that everyone who had ovarian cancer or currently has it has at least 4 of those chromosomes that are affected. Now that I've told you a little bit about Mayo, I'm going to talk to you about University of Texas MD Anderson Cancer Center. They are a college and a cancer center, so they are good for cancer. They are currently ranked number 2, and they have been top ranked for 25 years. They have been ranked, or they are located in Houston, Texas, and their college was created in 1885, and their cancer center was created in 1941. According to Ron Gilmore's 2014 article, Fast Tracking Immunology to Fight Leukemia, they discovered that Nuvalin stops tumor cells from connecting to your T cells, and if those connect, then it stops you from getting cancer, but this only works in leukemia, so blood cancer, and it only works on half the patients, so not everyone can get that treatment. Another research they are doing is called Research in Melanoma Medical Oncology. In their 2014 article, they discovered that melanoma is a skin cancer, and when it gets into your skin, it can go into your bloodstream, and then that's when you have to do chemotherapy. And they discovered that chemotherapy, when you're in chemotherapy, they destroy your white blood cells, so then the white blood cells, they take them out and then they put them in an incubator, and then they create new ones to mass produce clean ones and then put them back in, and then the cancer is, then they put the new ones in there and it helps the cancer defeat the cancer. And the third and final hospital I'm going to talk about is the Memorial Sloan Kettering Cancer Center. They're number 1, and they're in New York City, New York. They're the largest and oldest private hospital, and according to Gina Colada in her 2014 article, Study Points to Overdosing of Thyroid Cancer, they started this new program called the Wait and See program, because thyroid cancer is getting overdiagnosed. When you get diagnosed for cancer, you have to have a CAT scan or an X-ray or an MRI, and that involves a lot of radiation. So radiation is also what we use to get rid of cancer. So the cancer, they're trying to wait it off, and they said if you have it, and if you still have the bumps in a couple weeks to a month, they said come back, and then they'll test you for it to see if you actually have it. It's always good to catch it early, but they want to wait and see because it's being too overly diagnosed. In their 2014 article, Harold E. Varmus, he's a Nobel Peace Prize winner because he discovered that genes carry cancer. and those are called oncogenes. And he discovered that cancer is developed by any abnormal cell, and any abnormal cell that, when your cell just can become abnormal because of weather conditions or because of anything. So that basically we're like a genetic makeup of cancer. So whenever it comes abnormal, then we get cancer. Harold became the president of Memorial Sloan Kettering Cancer in January of 2000. Now that you've heard all my main points, I'm going to review them with you. The 3 best cancer facilities in the United States are Mayo Clinic, University of Texas MD Anderson Cancer Center, and Memorial Sloan Kettering Cancer Center. Now that you know a little, I want you to rethink of where you might want to take the ones you care about who have had cancer. It's kind of expensive, I know, but you can always do research and look at their websites and see different things they are doing. And then a quote by Wayne Dyer: everything that has happened to you is either an obstacle for you to grow, or an obstacle to prevent you from growing. You get to choose.